Are your periods getting heavier as you have entered your 40s? Is this worrying you? Or maybe you think it's just something that happens in this phase of life. And you're wondering, is this common? The answer is yes. But is it normal? No, it isn't. Many sisters notice that the periods get heavier in this age group. In this video, we will explore and understand why our periods might get heavier as we enter our later years and what we can do about it. Assalamu alaikum and welcome to my channel. If you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revered Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more energy, focus and confidence by following holistic wellness practices that are safe and effective, easy to follow and aligned to our deen. If you are interested in knowing more about perimenopause and menopause, I invite you to attend my free workshop, Hormonewise, where I talk extensively about perimenopause and menopause and all the different changes that your body goes through during this phase of your life. My client Sarah came to me complaining of periods that would last 15 days. She had been to her GP and was on medication to stop the heavy periods. She did not like taking medications and wanted to know what she could do to help have lighter periods. This heavy flow was taking over her life. She had to use large sanitary pads and multiple ones, and sometimes she would still soak through, mess her clothes, or even the chair and the car seat that she sat on. Needless to say, this was fairly embarrassing, and she really wanted this to stop without having to take medications all the time. Have you experienced this? Having periods so heavy that you stay in bed, keep staining your clothes. If you move around too much, the flow just increases so much that it really stops you from carrying on your normal everyday activities. Sarah and I worked together for 3 months, and by the end of 3 months, her periods were down to just 7 to 8 days, and the heavy bleeding was only on the first day. She did not have to wear extra thick pads anymore, and she could actually stop the medication that she was on. Her next blood test with her doctor showed that her hemoglobin had improved. She had more energy, and in her own words, it's as though she got her life back. So let's explore why women have heavy periods in their later years. A common reason for heavy periods is a form of hormonal imbalance called estrogen dominance. We have 2 main feminine hormones in our body called estrogen and progesterone. As we enter our perimenopausal years, just before the menopause, estrogen starts fluctuating wildly. So you can have very high estrogen and very low estrogen. Progesterone, on the other hand, declines as we enter our later years. Estrogen dominance is a condition where either we have excess of estrogen or we don't have enough progesterone, even though the estrogen is of normal levels. If you want to know more about estrogen dominance, do watch this video. So how does estrogen and progesterone impact our periods? Remember, estrogen is the builder. It builds the lining of the womb. And if there is a lot of estrogen, it's going to make the lining of the womb really thick. Progesterone, on the other hand, stabilizes the lining of the womb and prevents it from breaking down. So if you have a lot of estrogen, the lining of the womb gets very thick, and when you get your periods, you bleed a lot as this lining breaks down. If your estrogen is normal but your progesterone is insufficient, then what can happen is that the lining of the womb may be of normal thickness, but it keeps breaking down and shedding. And you can have really prolonged periods, sometimes heavy periods as well. So then what can you do about it? My first tip is don't think that heavy periods is normal in later years. As I said, it's common, but not normal. Make sure that you go to your doctor and get yourself checked out, because as the lining of the womb thickens, you may develop things like endometrial hyperplasia. This may lead on to precancerous changes or even cancer of the lining of the womb. And there is no way of guessing or figuring out if this may be the case till you get it checked out. Typically, your doctor would do an ultrasound of the pelvis and may take a little biopsy from inside the womb to make sure that there is no precancerous or cancerous changes happening. During ultrasound, your doctor may find that either the lining of the womb is thick, or you may have something called polyps, which are little tiny growths of the lining of the womb. Or you may have fibroids, which are little lumps in the muscle of the womb. So both polyps and fibroids can cause heavy bleeding, but are not cancerous. Now, all these conditions, fibroids, polyps, endometrial hyperplasia, all of them are due to estrogen dominance. Your doctor might also check your thyroid levels, because an underactive thyroid can also cause heavy bleeding in this age group. Now, if your doctor gives you all clear, you know that there is nothing going on inside the womb and there's nothing to worry about. The next step then would be to try and increase progesterone. Progesterone is mainly made in the corpus luteum in the ovary when you ovulate. And if you don't ovulate, you don't produce progesterone. Inflammation in the body can interfere with ovulation. So try and reduce inflammatory foods like sugar and cow's dairy. Try and reduce stress, because stress forces your adrenal glands to steal progesterone and make more cortisol, our stress hormone. So make sure you make time for reading that book you wanted to read, or going on a leisurely walk, or talking to a friend who really lifts you up. Try and practice breathing exercises to reduce stress, like diaphragmatic breathing or belly breathing. This activates the vagus nerve and reduces stress. Do watch this video to learn how you can do belly breathing or diaphragmatic breathing. Exercise in any form helps in the production of progesterone, as it reduces both stress and inflammation. There are certain minerals which help in production of progesterone, like magnesium and selenium. Sources of magnesium are nuts, seeds, and dark leafy vegetables. If you want, you can even take a supplement of magnesium glycinate at night to help increase magnesium levels. Sources of selenium are seafood, organ meats, and Brazil nuts. There are many other things that we can do to help have better periods, like correct insulin resistance and help in proper detoxification of estrogen. But these will be topics for future videos, inshallah. If you are on medication for heavy periods, carry on taking it and continue these lifestyle measures as well. Let me know if your periods have got heavier in your later years. What's helped you find relief? Let me know in the comments. I read every one of your comments, and your insights might help another sister feel supported. If you're getting heavy periods, it's possible that you may be having other symptoms of perimenopause, like weight gain, joint pains, acne, bloating. And if that is so, I have something for you. But before that, share your thoughts in the comments, and don't forget to like, share, and subscribe for more discussions on women's health during perimenopause and menopause from a mainstream medicine, holistic, and Islamic perspective. If you are experiencing different symptoms of perimenopause, I have created a playlist of the most common symptoms of perimenopause and actionable tips to help with them. Do check them out. Jazakumullah khairan for watching, and inshallah, I will see you in the next video. And remember, your best is yet to come.